Hello everyone, and welcome back to our channel. Today, we're exploring a health issue that impacts millions worldwide, diabetes. We'll talk about what it is, the different types, symptoms, and why managing this condition is so important. What is diabetes? First, let's understand what diabetes is. It's a chronic disease that affects the way your body handles glucose, a kind of sugar, in your blood. This happens when your body either can't make insulin or can't effectively use the insulin it does make. The process of glucose metabolism. Glucose metabolism is a set of processes that convert glucose, a simple sugar, into energy that the body's cells can use, and store any excess for later use. It's a crucial part of how our bodies function, and it's regulated by insulin, a hormone produced by the pancreas. Here's a more detailed breakdown. Digestion and absorption. When we eat food, our bodies break it down into various nutrients, including sugars like glucose. This occurs in the stomach and the small intestine. The glucose is then absorbed into the bloodstream, causing blood glucose levels to rise. Insulin release. In response to the rise in blood glucose levels, the pancreas releases insulin. Insulin is a hormone that acts as a key, allowing glucose to enter cells. Glucose uptake. Insulin binds to receptors on the surface of cells, triggering those cells to take in glucose from the bloodstream. Once inside the cells, glucose can be used as a source of energy. Glucose storage. If there's more glucose than the body needs for immediate energy, it's converted into glycogen and stored in the liver and muscles for later use. When blood glucose levels fall, such as between meals or during physical activity, the body can convert this stored glycogen back into glucose. Gluconeogenesis. If the body runs out of glycogen, it can produce glucose from other non-carbohydrate sources, like amino acids and glycerol, through a process called gluconeogenesis. Types of diabetes. Primarily, there are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes. Its causes, risk factors, and differences. Causes. This type is an autoimmune condition, which means it's caused by the body's immune system mistakenly attacking and destroying insulin-producing cells in the pancreas. The exact cause of this is unknown, but it's thought to be a combination of genetic predisposition and environmental factors. Risk factors. Family history of type 1 diabetes, presence of other autoimmune conditions, and certain geographical locations can increase the risk. Differences. It often develops in childhood or adolescence, but can appear at any age. People with type 1 diabetes need to take insulin for life because their body doesn't produce it. Type 2 diabetes. Its causes, risk factors, and differences. Causes. This type is primarily caused by insulin resistance, where the body's cells don't respond properly to insulin and can't easily take in glucose. The pancreas initially produces more insulin to compensate, but over time it can't keep up, leading to high blood glucose levels. Risk factors. Being overweight or obese, having a family history of type 2 diabetes, lack of physical activity, unhealthy diet, older age, and certain ethnicities are associated with a higher risk. Differences. This is the most common type of diabetes, often developing in adults, although it's increasingly seen in children due to rising obesity rates. It can often be managed with lifestyle changes, but medication or insulin may also be needed. Gestational diabetes. Causes. This type occurs during pregnancy when hormonal changes make your body less responsive to insulin. Risk factors. Being overweight before pregnancy, family history of type 2 diabetes, being over age 25, or having had gestational diabetes in a previous pregnancy can increase the risk. Differences. It usually goes away after the baby is born, but women who've had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Recognizing the symptoms of diabetes is vital for early detection and management. Common symptoms include increased thirst, frequent urination, unexplained weight loss, and fatigue, among others. The symptoms of diabetes often develop gradually, and they can be easy to overlook. These can include increased thirst and urination. As excess glucose builds up in your bloodstream, fluid is pulled from your tissues. This may leave you thirsty and needing to urinate more frequently. Increased hunger. Without enough insulin to move sugar into your cells, your muscles and organs become depleted of energy, triggering intense hunger. Unexplained weight loss. Despite eating more than usual to relieve hunger, you may lose weight. Without the ability to metabolize glucose, the body uses alternative fuels stored in muscle and fat, causing weight loss. Fatigue. If your cells are deprived of sugar, you may become tired and irritable. Blurred vision. If your blood sugar is too high, fluid may be pulled from your lenses, affecting your ability to focus. Slow healing sores or frequent infections. Type 2 diabetes affects your ability to heal and resist infections. So, how is diabetes diagnosed? Diabetes is diagnosed through several different types of blood tests. A1C test. This test measures your average blood sugar level over the past 2 to 3 months. Fasting blood sugar test. This test measures your blood sugar after an overnight fast. Random blood sugar test. This test measures your blood sugar at a random time regardless of when you last ate. Oral glucose tolerance test. For this test, you'll fast overnight and then drink a sugary liquid. Your blood sugar levels will then be tested over the next several hours. If any of these tests show that your blood sugar is higher than normal, you may be diagnosed with diabetes. Your healthcare provider may also use these tests to monitor your diabetes and guide treatment decisions if you've already been diagnosed. Managing diabetes involves a careful balance of lifestyle changes, medication, and regular monitoring. Let's break that down. Firstly, lifestyle changes. This includes healthy eating. It's crucial to focus on foods low in fat and high in fiber, such as fruits, vegetables, and whole grains. A dietitian can help create a meal plan that fits your personal health goals, food preferences, and lifestyle. Regular exercise. Physical activity helps lower your blood sugar level. You should aim for at least 30 minutes of moderate exercise most days of the week. Weight management. If you're overweight, losing even 5 to 10% of your body weight can reduce the risk of diabetes complications. Next, medication. Depending on the type of diabetes, you might need insulin therapy. People with type 1 diabetes and some with type 2 need to take insulin, which can be injected using a syringe or an insulin pen, or infused via an insulin pump. Oral or injected medications. Some people with type 2 diabetes can manage their condition with lifestyle changes and diet, but many also need diabetes medications or insulin therapy. These drugs help your body produce insulin, make your body more sensitive to insulin, or slow down the digestion of carbohydrates. Lastly, regular monitoring. Keeping a close eye on your blood sugar levels is key. Self-monitoring. This involves regularly checking your blood glucose levels at home using a device called a glucose meter. A1C testing. This blood test shows your average blood sugar level over the past 2 to 3 months and helps your healthcare provider adjust your diabetes treatment plan. Diabetes management is a lifelong commitment. Regular checkups and discussions with your healthcare provider are crucial. Remember, the goal is to keep your blood sugar levels as close to normal as possible to prevent complications. We hope this video has helped you better understand diabetes. If you found this information valuable, please give this video a thumbs up and share it with your loved ones. Don't forget to subscribe to our channel for more health-related content. Remember, your health is in your hands. Thanks for watching, and take care.